The DNA health test reveals a number of things around our DNA, but specifically how well specific metabolic processes are working in our body, and based on how those metabolic processes are working, will they increase one's risk for disease or offer protection against disease development? So really, by understanding those genetic variations and how they might influence a specific area, such as lipid metabolism or bone health risk, looking at osteoporosis risk, understanding that process from a genetic and a cellular level gives the practitioner insight to give personalized nutrition and lifestyle recommendations to improve longevity, aging well and happily and healthily, and decreasing risk of disease. The DNA health test covers a number of different biochemical and biological areas, including lipid metabolism, assessing genetic variations involved in cholesterol metabolism, so looking at your good versus your bad cholesterol and risk for cardiovascular disease. Then it looks at this area of methylation. More in an easier way to understand it is looking at your vitamin B requirements and your DNA health as such. It looks at the area of detoxification, so that area of how well we are able to activate specific chemicals and then neutralize and excrete chemicals and carcinogens from the body. And in that area, it is strongly related to chemical sensitivities as well as DNA damage and risk for possible or certain cancers. We also look at the area of inflammation. So in this area, we're looking at markers that are involved in this area of chronic low-grade inflammation. And if we have higher levels of inflammation on an ongoing basis, it has been related to a number of diseases of lifestyle, including diabetes, specific cancers, as well as cardiovascular disease. We then look at the area of oxidative stress. So in this area, we are testing for genetic variations that have been related to our internal antioxidant enzymes that are able to neutralize pro-carcinogens, free radicals, and really protect our body from high levels of oxidative stress. Then we look at the area of insulin resistance or risk or insulin sensitivity, looking at genetic variations in insulin sensitivity that are associated with risk for developing insulin resistance, and how can we mitigate those risks with specific lifestyle and dietary interventions. And then we look at the area of bone health, and in this area we're looking at genetic variations that have been associated with risk for osteoporosis, and how can we decrease those risks with specific nutrition interventions such as vitamin D and calcium supplementation. And then lastly, we look at this area of food responsiveness, which is really a number of different genetic variations all related to different food types. And in this, we look at lactose intolerance in adulthood. We look at one's ability to metabolize caffeine and assessing risk for cardiovascular disease. We look at salt sensitivity and blood pressure. Interestingly, not everyone is salt sensitive, so when some people have high blood pressure, not everyone will respond to having low blood pressure or decreasing their blood pressure by decreasing salt intake. So it's important to understand this and for the practitioner to know this. We also look at this area of bitter taste. So some people have what we call, or are what we call, high bitter tasters, and because of that they may not like their vegetables. And how can we then change certain things in their diet to hide maybe the flavor of the bitter tasting vegetables? And then lastly, we are looking at this area of what we call hereditary hemochromatosis or iron overload. And so it's a very nice screen for individuals susceptible to this. The DNA health test can be used for individuals who are living a generally healthy life, but they want to just improve specific aspects of their life. So these are individuals who are doing most things right, but they want to really personalize their lifestyle to feel even better. So it's really getting to those people who just want to be at the top of their game all the time. The tests can also be used by practitioners who are struggling with certain patients by trying to identify specific biochemical areas that might be weakened because of genetic variations. And with the practitioner being able to understand where these areas are, they can better treat their patients with nutrition and lifestyle recommendations and get insight into complicated diseases such as fibromyalgia or chronic inflammatory disorders, pain disorders. All of those kinds of areas have a very good, the DNA health test gives a very good understanding of the biochemical areas that are not working properly. And then it's for individuals who may have a concern about a family history of disease from a diseases of lifestyle point of view, such as a cancer or a cardiovascular disease or diabetes. And by the practitioner getting insight into what biochemical areas again might be weakened because of these genetic variations, we are able to intervene with personalized nutrition and supplement recommendations to try and offset those risks. These test results can be used in corrective measures where certain individuals already coming into the practice of the healthcare professional with disorders from a pain disorder to a disorder that might be difficult to diagnose. It gives the practitioner a lot of insight into biochemical areas that are not working well, and so by understanding those areas, the healthcare practitioner can intervene in a corrective manner by giving therapeutic doses of certain nutrients to offset certain areas that are not working properly. That area can also, or this test can also give insight for the practitioner to know what further tests to do to get a more accurate diagnosis. And this is really where the area of functional medicine, where the practitioner will look at the patient as a whole, taking all areas of their life into account when treating the individual. And then in terms of a preventative lifestyle measure, this is where individuals who may have a concern around a family history of disease or just be someone who's actually living quite well, but there are certain tweaks that can be made, and prioritizing certain things may be of benefit to certain individuals to prevent diseases of lifestyle from occurring and living a healthier life. So it's not just about living long, but it's about living well. The DNA health test provides a lot of very important information in terms of micronutrient recommendations, specific levels that one individual might need of a specific nutrient versus another individual, and so looking at nutrients in food types to prevent disease, as well as to intervene with diseases manifesting. And how it works really well with the DNA sport test is that for any athlete, whether they be a professional athlete or a weekend warrior, we like to call them that, for them to perform as well as possible, they need to be at the top of their game, both in terms of the athletic performance but also health. They cannot perform well if they're not recovering well, and if certain areas based on genetic variations may be leading to biochemical processes being weakened, they cannot perform well. So it relates very well to do the DNA health test and the DNA sport test together to get the best performance for an individual. In terms of the DNA diet test, DNA diet is focused very much on weight management, but weight management is only one part of the puzzle when it comes to general health. And so what the DNA health test offers is this extra area of motivation and just improved health and energy, with specific nutrient requirements being put into place, together with looking just solely at weight management. I think the DNA health test is a very important test. Of all of the nutrigenomic tests that we offer, I would always recommend that no matter what your focus is, whether it be weight management or sports performance, or specifically looking at DNA estrogen and detoxification, the DNA health test offers the most comprehensive amount of information in terms of different biochemical processes, in giving recommendations that are personalizing nutrient recommendations, and also looking at disease risk mitigation. So this, I would say, is it's definitely the most comprehensive of all of the tests. And when looking at personalized nutrition, personalized healthcare, this is the area where there is the most amount of research. And I think in terms of the long term and what it's going to benefit an individual in the long run, is going to be of utmost importance to include this test for this area of personalized healthcare.